AI FM workflow. Welcome to the Fetal Medicine Radiology module designed to simplify obstetric ultrasound reporting, improve workflow efficiency, and assist with structured fetal imaging documentation. In this video, we'll walk through the complete workflow of using the fetal medicine reporting system from patient registration to final report generation. To begin, open the fetal medicine module from the dashboard. You can quickly search for an existing patient or create a new patient profile by entering patient details including name, age, gestational age, referral information, and clinical history. Once the patient profile is selected, the reporting workspace opens automatically. The module is designed specifically for structured obstetric and fetal imaging workflows with organized templates and AI-assisted reporting tools. Now select the appropriate ultrasound study type such as first trimester scan, NT scan, anomaly scan, growth scan, Doppler study, biophysical profile, or fetal echocardiography, depending on the clinical requirement. Once the study template is selected, the structured reporting interface loads automatically. The platform organizes findings into dedicated sections for biometric parameters, fetal anatomy, placenta, liquor assessment, Doppler findings, cervical assessment, and maternal observations. Fetal biometric measurements including CRL, biparietal diameter, head circumference, abdominal circumference, femur length, estimated fetal weight, gestational age, and percentile calculations are automatically organized into the correct sections. The platform also supports documentation of anatomical findings involving the brain, spine, face, thorax, heart, abdomen, kidneys, limbs, and other fetal structures. Placental position, cervical length, amniotic fluid measurements, and Doppler parameters can also be entered quickly within the same workflow. Fill in the maternal biochemical tests, blood pressure, or diabetic profile for complete risk assessment. Generate the AI-assisted report. The system helps maintain structured and standardized fetal medicine reporting. The AI assistant may also provide intelligent prompts and structured suggestions during the reporting process to improve completeness and reporting consistency. There is quality analysis QA check with clickable options to complete and refine the report and smoothen any pitfalls or overlooked segments. Also, a second opinion can be generated to further analyze and understand the nuances of the findings for clinical discussion. It can also be incorporated in the final report. You can review all generated findings at any stage and make edits whenever required. Every section remains fully customizable under radiologist supervision and control. The platform also supports automatic generation of clinical impressions and structured summary reports based on the documented findings. Measurements, calculations, and observations remain organized in a clean and readable format for improved reporting efficiency. Various risk calculations for genetic disorders are done and depicted in charts. Once the examination is complete, carefully review the generated report and confirm all findings. The finalized report can then be exported, printed, shared, or integrated directly into the radiology workflow system. There is Patient Pack, which can be generated, which details the patient information, referring doctor note, instructions for follow-up imaging, and can be downloaded and shared in soft or hard copy. This tool enables faster reporting, detailed, improved documentation quality, better workflow management, and seamless fetal medicine reporting. AI-powered fetal medicine workflow designed for smarter ultrasound documentation, faster reporting, and structured radiology excellence.